Hey everyone, thank you for being with us today. I'm Rick McClung, Vice President of Sales for Avcor Healthcare Products, and today we're going to be talking about a new product in the market for post-amputee wound care and the post-amputee shrinkers and our post-amputee tubing. And I am delighted today to have the inventor and developer of this product, Alan Bucky Solomon. Just a quick background on Bucky. Bucky served for several years as a combat medic in the 75th Ranger Division of Operations in Afghanistan. And between military and post-military contractor work, Bucky, I don't know if anybody's ever surpassed this or not, but Bucky has done over 35 deployments and tours of duty, serving our country and serving as a combat medic, where Bucky basically came up with the idea of a better way to dress and treat trauma as it relates to amputation. So see if Bucky, have you joined us?
Yes, sir, I'm here.
Hey, great to see you, Bucky. Thanks for taking some time out of your schedule now in the hospital to talk to us about your amazing product, the SOLO Bandages and SOLO Shrinkers. I want to ask you a few questions today. In our audience, we will have both clinical people, and we will also have people from the amputee community. So if you don't mind, I'll just ask you a little bit, tell us a little bit about yourself. And I guess the first question on everyone's mind, how did you come up with a SOLO product?
Yeah, absolutely. Thanks for having me. First of all, Rick, I originally thought of the product when I was helping out at Ford surgical teams in Afghanistan after both local, national, and American soldiers were brought in, and they had an amputation when they came into the trauma center, or we ended up doing an amputation due to their wounds. I was like, man, there's got to be a better way to bandage this amputation, both at point of injury and then after. So I slowly came up with different prototypes, and we have what we have today.
Okay.
From that.
Bucky, I know I was fortunate enough to get to meet you about 7 years ago, the early on prototypes of the product. Since then, I know that you've made several changes, and if I could just regress for a second, Avcor is your master distributor for the SOLO products, but to my knowledge, there's no other product for either the SOLO Bandage or the SOLO Shrinker that's both infused with zinc and silver. Am I correct on that?
That's correct. So we use our SOLO tube in both the bandage and the shrinker. So the SOLO tube material is completely coated in zinc, and then there is silver sewn into the material as well for the antimicrobial and antifungal factors both.
And in my studies and looking at clinicals on that, the zinc and silver actually help eliminate odor and possible bacterial migration, and would actually help in the healing of the wound and just making the product more comfortable and efficient for the patient to wear. Am I correct?
Yes, sir. Absolutely. Anything to decrease any sort of bacterial or fungal growth is going to help with healing and also cut down on that possible odor.
And you make this product, it's 100% made in the United States with cotton fibers grown here in the United States also as well.
Yes, sir.
All right.
Everything is grown and made and assembled in the U.S.
All right. Thank you so much. Kind of getting into some more in-depth into the questions. I know that early on you had patients, I won't mention any names here, that were having some issues with healing and so on and so forth. And you work with them using the SOLO product. What were the outcomes as far as a faster healing or more comfort or reduction of phantom pains with those patients?
Correct. So with our the sizing chart that I developed, we can apply the appropriate sub bandage pressure to that limb to get all and to get that swelling back into out of the third space and back into the vascular system to aid with healing, so you don't have all that just residual fluid sitting there. And we're also with the phantom pain part is you're providing the compression that the limb would normally have and appropriate compression. Let me kind of highlight that, but appropriate compression, and then that nerve is happy again as it
Perfect.
would be if the rest of the limb was still there.
On one of the patients as well too, if I'm not mistaken, having some issues with sutures pulling out post-op, in the healing process, there seemed to be getting a lot of infection there and couldn't heal. What was your experience with them using this as far as the timeline that they were able to heal after beginning to use this versus traditional ACE wraps or gauze wraps and that type thing?
Yeah, absolutely. So that's a great question. And with that patient, he was using ACE wraps as his providers wanted him to do. But the issues with ACE wraps is they lose their elasticity after 4 hours. They should be replaced. When you put an ACE wrap on, it doesn't matter. I could put on five different ACE wraps, and I wrap the limb very well. But it's going to be five different sub bandage pressures, no matter how well I do it. Whereas if I put on a solo bandage, or you put on a solo bandage, or anybody there with you today puts on a solo bandage, it is going to be the same sub bandage pressure to the limb, um, that's going to aid in the healing. Because again, it's going to try to get that edema back into the circulatory system out of the residual limb, and therefore promote healing through proper blood flow.
Right. So what I'm hearing you say, Bucky, is that with proper measurement for either the bandage or the shrinker, which is quite simple with your chart, knowing what compression you want and doing one really very simple measurement above the amputation site on the residual limb. Using this product properly fitted, you're going to get a more consistent application on that patient time after time. With that said, how easy or how hard is it with the Solo product to don that product on the patient?
It's extremely easy, Rick. So I've even had patients that had an amputation through their mid forearm, and they are able to put the product on with just one hand.
Wow.
So I mean that's not preferable, but it can be done.
Okay. So and they're going to have consistent application of the product, putting it on themselves and having dealing with the amputees. I would say that would probably lend to giving some independence back to that patient.
Absolutely, absolutely.
As far as phantom pain, I know I have seen some testimonials that have come in from the end users of the product. What are you hearing as far as this helping to reduce the phantom pain that many of our patients experience?
Correct. So everybody that I have directly spoken with, all of my patients that I've used this with, amputee patients, they they have seen a remarkable reduction, if not full elimination, of their phantom pain.
All right.
So as I spoke a little more, to speak a little more in depth earlier, like your limbs have compartments in them to regulate the pressure within inside your arm or leg.
Right.
Well, when you amputate something, you don't have, say, like your dorsal flexion with your foot, dorsal and plantar flexion. You don't have that anymore. So your muscles aren't moving that blood, and the limb isn't providing the compression on the inside that it normally would. Well, with my bandage, it kind of adds that back, uh, that compression that would normally be there through, once again, appropriate compression to the limb.
Thank you very much. And overall, what I guess my one takeaway that I have from just the last few questions is that I can see that the patient would comply better with the doctor's orders or from rehab once they leave the hospital. I think they'd be more apt to change their dressing as often as they should,
Absolutely.
and knowing that it was properly put on.
Correct. So, my grandfather on my dad's side was a bilateral amputee, and I know my grandmother absolutely hated changing his bandages because they need to be done at least once a day initially, if not even twice. Uh, so this would have greatly helped her with the bandage changes and him. But patients providing more um, just easy overall easy use instead of leaving the same bandage on for the whole week until their next follow-up, or they end up taking it off because it hurts, and then they come back and the wound hasn't healed at all because they haven't had any compression on there, or worse.
Right, and I would assume that with proper compression, and as you treat,
It's going to feel better.
Yeah,
it's going to
they're
aid in
going
the
to feel
healing.
better. The compliance, and that as we go forward, I'm kind of thinking that both the bandage, along with the shrinker, obviously, but the bandage would start actually shaping that residual limb faster than if you were wrapping with gauze or an elastic type bandage. Am I correct?
Absolutely. So the way the bandage and shrinker are designed is to start shaping that limb and apply as close as possible even compression and around the entire limb surface.
And the faster that shapes, and the faster we could get the swelling and the edema under control, the quicker I would assume they could get into their, with the healing in mind, get into their prosthesis or start being fitted for their first prosthesis.
Correct. Until that wound has healed, they can't even start dealing with getting fitted for a prosthesis.
Gotcha.
Yeah, because it would just reopen up that limb. So again, proper compression based off of the sizing charts and the different size bandages and different lengths to how where the amputation is performed. It's all there.
Wonderful. Bucky, I can't tell you how much I appreciate your time. I guess one of the last things that I would say to the clinical people and the end users on this product, from a financial standpoint, there are also benefits of savings versus some of the, I guess I would say, traditional shrinkers and bandages out there. Number one, you eliminate a lot of different products that have to be gathered to treat a amputation post-operative. Also, when they go home, somebody's going to have to gather something at the local drugstore to treat that, whereas now you're buying one little simple, and if you don't mind, I mean, this is it right here. This is all you need. It's a totally self-contained product. So aside from the clinical advantages that you have explained to us this morning, their financial advantages, I think this product sells for less than half of what a typical neoprene type shrinker or all the ancillary products that have to get. So that benefits the amputation or amputee community, and we appreciate that. And I would be at a miss if I didn't also mention to the viewers with us this morning that Bucky is a combat wounded vet and was awarded the Silver Star. So Bucky, in closing today, I would just like to say thank you very much for your service and your continued service in the healthcare community in New York. I appreciate you very much, and look forward to getting you back in Texas pretty soon.
Thank you, Rick. Thanks for having me.
You're so welcome. See you soon.